Okay, hello everybody, good morning. Dr. Howerth here of Vet Triage. It is September 26, 9:44 a.m. Pacific time. This is the third attempt to do a live stream this morning, freaking YouTube. Anyway, we're gonna review again this journal article, or this journal here, boom, JAVMA, December 2017. And this is Pathology in Practice. This is a segment in JAVMA where they go over a pathology case. So for those who don't know, pathology is divided in two different categories. There's gross pathology, which means the macroscopic, so the external view of an organ or tissue or whatever in the organism. And then there's microscopic or histological pathology, histopathology, which is the microscopic version. And of course, the two obviously go hand in hand. You can't really have one without the other. But we often do comment that the histology, or rather pathology in general, is the temple of all knowledge in the field, because they see everything not just grossly, but more importantly, probably microscopically. They always get the answer, and so it's very useful as in our field. So this is going to be a case. Here is the tissue they show. It's kind of gross. Sorry for those who are eating during this. And this is a picture of an intestinal mass, a colonic mass in a Vietnamese pot-bellied pig. So we're going to talk about that. It's a 14-year-old female spayed Vietnamese pot-bellied pig. She had abdominal surgery about 5 years prior for a colonic mass resection and anastomosis. The colonic mass came back as adenocarcinoma 5 years ago, and the symptoms at that time were characteristic of an intestinal obstruction, not eating, weight loss, that kind of thing. So since surgery, she's had anorexia and abdominal distension for that entire time period. So because of worsening over a day or two before surgery, they ended up taking her back to surgery. So they removed the colonic mass, and they said here in surgery, they found not just a colonic mass, which was 6 by 5 by 6 centimeters. They also found an adjacent mass, similar in appearance, 2 centimeters in diameter. And then they saw that the intestinal loops were distended cranial to the mass, so indicating that there is an obstruction. The histologic diagnosis came back as colonic mucinous adenocarcinoma, so it's affecting the spiral colon, and we're going to talk about what that means. So if those of you who don't know that we do surgery in pigs, we do, obviously. So a couple of key features here with this case report, because you probably would have assumed if the pig had a previous cancer removed from the intestines and now is still showing similar signs, that it would be recurrence or spread of that cancer. And so that's not the twist here necessarily, or rather what you can gain from this article. What you can gain is a few things that we'll talk about here. So they found immunoreactivity of the cancer cells to a chemical called pancytokeratin. Now, what that is not as important as is the immunoreactivity. It has been a powerful tool in histology to be able to apply a chemical to the cells and see what cells display or uptake that chemical. And immunoreactivity testing, or immunohistochemical staining, whatever you call it, is a way of narrowing down the cell types, not just based on morphology, which is what we typically do when the pathologist looks in the microscope. They describe the cells. They say, okay, these cells most likely are this type or that type or whatever. This actually goes into more of their cellular characteristics, so that you can be more certain that the cell you thought it actually is. You can imagine in the case of cancer, sometimes cells are so deformed, mutated, dysplastic, we call it, that you can't even really tell what kind of cell it is. And the same thing happens not just with cancer, but also with inflammation and infection. So immunoreactivity, immunohistochemical staining are very powerful tools that pathologists use. And so they use that here to decipher this was actually a colonic mucinous adenocarcinoma. Adenocarcinoma is rarely reported in pigs, but in pigs, pot-bellied pigs are often the ones that are diagnosed with it. The thought there is that domesticated pigs, which are usually slaughtered at an early age for food, for human consumption, they can't grow old enough to get cancer, whereas the pot-bellied pigs are popular pets, and so they can live for many, many years under excellent care of their caretakers. And so whenever you have a pet that becomes older, they are prone to developing cancer. Cancer is a very rare occurrence in younger animals. So aging is one thought process as to what's causing adenocarcinoma in pigs. The same aging process is thought to cause uterine neoplasia in miniature pet pigs. However, there are other factors, and this is true for any cancer type pretty much. Genetic predisposition, diet, and environmental conditions can also influence development of these tumors. Typical clinical signs include anorexia, weight loss, vomiting, diarrhea, colic, ascites, anemia, and that's all due to the chronic blood loss from colonic ulceration in the animal. It can also affect jejunum and the cecum. They are locally invasive, and this is true in dogs and cats as well. They usually cause a focal constriction and luminal stenosis, meaning that when the tumor is growing, it's actually not just growing outwardly, or sometimes won't even grow really much outwardly, but it'll grow internally and make the intestinal diameter shrink. And of course, that causes an intestinal obstruction, and then you get the clinical signs. The same is true with dogs and cats. In dogs and cats, I believe there's 3 different types of adenocarcinoma, which I'm sure we'll talk about in a future live stream. But luminal stenosis from adenocarcinoma is what they most often see in the pigs. It can metastasize. It can metastasize to regional lymph nodes, lungs, and liver. It was unknown whether or not the resection was complete at the first surgery. So it's important when you're performing cancer surgery that the surgeon tries to be realistic with what they can do as far as removing the entire thing and not cause additional harm to the patient. But also, if you have the opportunity to remove the entire thing, again, depending on the patient, where it's located, that kind of thing, then you want to remove not just the entire tumor, but you also want to remove what we call margins. Margins are a certain distance of tissue that go from the very edge of the cancer to into normal tissue. So, for example, you may say that for adenocarcinoma of the intestines, you're looking for 5-centimeter margins, meaning that from where the tumor ends till about 5 centimeters in both directions, or in all directions of that tumor, you're trying to remove that much tissue. So you not only get the cancer, but also a certain percentage of normal tissue as well. And that's important to get clear margins. Clear margins has a higher chance of being a curative surgery, or at least having it add positively to the prognosis of the patient, so that if the cancer does come back or spread, it will be farther into the future. So we don't know in this pig's first surgery whether or not the margins were clear, but recurrence and metastasis are common in intestinal adenocarcinoma. Mucinous adenocarcinoma is a subtype of intestinal adenocarcinoma, same thing in dogs and cats. At least 50% of the cells in these cancer types produce mucin. Mucinous adenocarcinomas in domestic pigs and Vietnamese pot-bellied pigs have been rarely described. That's why they're featuring it in this journal. Dogs, cats, cattle, ferrets, and primates, including people, can also be affected by this cancer type. And and so there's the histology for anybody who's interested in looking at that kind of thing. That's beyond the scope of this talk, but pretty cool case. Certainly a rare one, and hopefully a learning opportunity for those watching, not just those who practice on dogs and cats, but who practice on anything else. And that's a short one. We'll be back tomorrow again, September 27th, for another live stream. Thanks for those who attended and who watched in the playback. We'll see you in the next one. Bye-bye.